Well, hello, everybody. Thank you for tuning in today. Welcome to It's Time for More Injury Funding Podcast, the podcast for all who want to learn about legal funding and its significance in the personal injury, wrongful death, immigration, medical malpractice, and many other types of law practice domains. I'm your host, Laura, founder and CEO of More Injury Funding, the legal funding counselors with passion for law, legal funding, and heart for all suffering individuals. More Injury Funding is a sponsor, member, associate, or business partner of this podcast, Academy of Truck Accident Attorneys, Sandy Spring Bars Association, Georgia Association of Paralegals, Atlanta Legal Aid Society, State Bar of Georgia, and Georgia Hispanic Chamber of Commerce. In today's episode, we have a very special guest, Dr. Robert Allen. Dr. Allen is the clinical director of the Concussion Center based in Atlanta, Georgia. The Concussion Center is the next phase in the evolution of brain health. Their team takes the guesswork out of brain diagnosis and focuses on the unique environment, needs, and medical history of each patient. Without any further ado, let me introduce Dr. Robert Allen. Welcome to It's Time for More Injury Funding, Dr. Allen.
It's a pleasure to see you. Appreciate the opportunity.
Absolutely. So let's start with our conversation about you telling us why the Concussion Center is in Atlanta stands out when it comes to traumatic brain injuries. What is your clinic's main and specific specialty?
Absolutely. Specialist when it comes to concussion or mild traumatic brain, which is actually one and the same. They're the same thing. So our whole goal with the Concussion Center was to be able to have a place where patients can come, have access to all the different care team members that are needed for evaluation and management of concussion, and be able to complete their journey in the same place. They know the team, they work with them from the beginning to the end of their process, and they're working with experts in the area to make sure that we can diagnose the patients, figure out specifically where we need to focus our energies, put our energies there, get them better, and then get them back out to normal daily life.
I love it. And Dr. Allen, what is concussion?
That's a great question. So a concussion is it's a mild traumatic brain injury. When we look at brain injury, there are obviously different levels. Most people know moderate and severe TBI. People think coma, they think loss of consciousness for a long time, structural damage to the brain itself. When we look at a concussion, it's a little bit different. So it is a brain injury. However, by definition, when we're looking at a concussion, if we do a normal CT scan or an MRI of the brain, there's no damage that we see. Okay, we don't see anything structurally wrong. However, what we do see with these patients are what we call functional impairments. So that's memory issues, attention problems, dizziness, eye movement problems, headaches, fatigue, sleep issues, insomnia. We also see neck injuries that are associated with concussion. And of course, we see a lot of emotional changes. So anxiety, depression, stress, phobias, those sorts of things as well.
How interesting is that? Can you please tell us about what is behind the science of concussion? How does it usually occur?
It's a great question. When we look at a concussion is usually related to acceleration and deceleration. Looking statistically, concussion tends to happen at about 70 Gs, okay? So that's usually about a 35 mile an hour car. If you're riding in your car and you get rear-ended about 35 miles an hour, that's about a 60 G impact, okay? So typically we see a concussion occur between 70 and 120 Gs.
Okay.
That's where we see it happen. And the thing about a concussion where we see a lot of things have changed with the science behind it is that you don't have to hit your head to have a concussion.
Interesting.
Just getting rear-ended or getting hit, however it may be, the acceleration and deceleration of the head and the brain can be enough to actually cause the injury to occur. Okay. You also don't have to lose consciousness to have a concussion.
Okay.
So those are two real common things that we hear from patients are, well, I didn't hit my head and I never lost consciousness. Doesn't mean you didn't have a concussion.
Good to know. Now, how different is concussion from a whiplash? And do you use different medical or scientific methods to determine the correct diagnosis?
Absolutely. So the way you can have whiplash without having a concussion. If you have a concussion, you most likely had it. The symptoms can be similar. A lot of patients can complain of dizziness with whiplash injuries. They can have other problems like headaches and things like that can occur because of the trauma that occurs with the neck. However, again, a whiplash usually occurs at a lower G force as opposed to where a concussion does. That's why we say if you had enough of an impact to cause a concussion, you likely had enough of an impact to cause whiplash.
Okay. So, in the personal injury field, as well as on social media, on the news, broadcast channels, and in everyday conversations, there's an ongoing conversation about myths and facts about the concussion. Can you please share some of those myths versus the actual facts?
Yeah, that's a great question. We kind of touched on you don't have one of the biggest myths that we still see is that people say if you have a concussion, you need to go in a dark room and sit there for 2 weeks, 3 weeks. That's the only way to really be able to manage it, and that's not true at all. We say rest for the first 48 hours after injury. Then after that, we actually need to get you moving. The more that we can get you engaged, the more that we can get you moving and doing things that you've done prior to injury, typically the faster it'll help heal. One of the big things that we do is we actually use exercise as science. We use exercise as medicine. And what I mean by that is there are certain different exercise strategies that have been verified, scientifically studied, that can help with the management and treatment of concussion. The next thing that we also see too is the old saying that you have to always wake somebody up every couple hours when they have a concussion. If we have an injury and we're able to rule out anything serious like a brain bleed or something like that, we don't need to be waking somebody up every couple hours. Right? Let them sleep. Let them get a little bit of rest. It's probably better for them than keeping them up every hour, every 2 hours, something like that. Those are really the main ones that we see typically. The other thing I guess I would say is that there's no way that we can truly diagnose a concussion. That's what we see a lot because people say these are subjective complaints. And that's not true. That's not true at all. We have a lot of different tests that we can do on how patients are functioning in different ways to actually be able to get some objective data behind that and use that information to help aid in the diagnosis of a concussion.
Okay. Are there different known types of TBIs or traumatic brain injuries, and where does concussion fall on this scale?
Yeah, there are three main categories. There's mild traumatic brain injury, which is what a concussion is. There's moderate traumatic brain injury, and then there's a severe traumatic brain injury. I think that mild is a bit of a misnomer because people say, well, it was a concussion, it was a mild TBI, it's not that bad. And that's not necessarily the truth. It can have a lot of life-altering impacts if people don't get the symptoms managed. When we're making a diagnosis, some of the criteria that we use are we look at, was there loss of consciousness? Okay, again, you don't have to have a concussion, but if you lost consciousness from 1 second up to about 30 minutes, that's typically in the realm of what we call a concussion or mild traumatic brain injury. Losing consciousness for an hour or more, up to about 24 hours, that falls then more into the moderate TBI category. Then, of course, past that, if we're loss of consciousness for more than 24 hours, then we're looking potentially at more of like a severe TBI. Other things we see too with a concussion, mild traumatic brain injury is that again, on normal imaging, so a normal MRI and normal CT scan, we typically don't see any structural changes or damage to the brain, which we can see with a moderate and severe TBI. We also have a tool, it's called the Glasgow Coma Scale. The Glasgow Coma Scale looks at a couple different areas and how patients respond to certain stimuli. And with a concussion, the Glasgow Coma Scale is between 13 and 15. Right? Anything below that, we start to get into different categories, and it can help aid in the determination of what kind of brain injury we're looking at.
Okay, I'll need to read up on my, or polish up on my medical terminology right there. How can a concussion affect one's brain, short or long term? In other words, what common physical, mental, and emotional symptoms a person displays following a concussion?
A great question. Really, when we get down to the core of what a concussion is, it's an energy deficit in the brain. ATP is something that the brain produces, and it helps with our energy in the brain. It helps us function. And following a concussion, we don't produce ATP at the same level as we did initially. It's about a 20% reduction in the brain. So that's where we tend to see these functional impairments come from for patients. It's harder for them to function because they just don't have the energy in their brain that they had prior to. With patients, I like to a lot of times kind of explain it as your brain just ran a marathon, but now it can't get a snack, can't get a blanket to warm itself up, it can't get a ride home. Okay, you're functioning at a deficit. We look at a concussion and we see that typically that energy deficit persists for about 4 to 6 weeks before it starts to resolve or resolves. Now, patients can absolutely exist in a deficit and have symptoms that go longer than 4 to 6 weeks. But that's where we start to see that energy return to its more normal state. The big thing about a concussion, and this is what we see a lot with when I'm having conversations with patients, family members, kids, parents, whatever it may be. You look at a patient with a concussion, and typically you don't see anything quote unquote wrong with them. So what I mean is, if we're looking at someone that doesn't have any other injuries, just the concussion, there's nothing physical that we're really seeing on them. You don't have a cast on, they don't have a Band-Aid or anything like that. And that's why so many people tend to not get their concussions diagnosed. You know what, we estimate that maybe up to 75% of concussions go undiagnosed. There's some estimates out there. But that's one of the big things where education can help, is being able to say, well, just because you look normal, you can still have an injury, you can still have a concussion, and it can absolutely impact you. We see a lot of issues for patients. For example, people that have been very high functioning, high level executives, doctors, lawyers, whatever it may be. Following the injury, they can develop different emotional changes, anxieties, mood changes. A lot of times it's because people that are used to functioning at a very high level just can't function there currently, right? They got that energy deficit in the brain, harder for them to concentrate. Maybe they get a headache after they're concentrating, and they start to develop, they can have irritability, anger issues, depression. Those can pop up as well because of these different things that happen when we are looking at these injuries. So we have to very much take a lot of different areas into consideration. We actually use the 6 kind of trajectories, is what we call them. They're defined by the American Academy of Neurology. We look at all of those, and that's one of the most important things for us, and kind of our foundation when we were establishing is, if we're going to look at concussion, we have to look at every aspect of it.
Is there any medical or scientific way to track and observe concussion?
There it is. One of the big things that we use are eye movement abnormalities. So immediately post-injury, we can look and see, how does a person's eye movement react to different tests and different test types. We can then use that information to create a therapy plan and then track their progress as they get better. Now, one of the things that we're doing here is we're actually beginning to work with a lot of sports teams, so youth sports and things like that, to perform baseline testing on athletes prior to a season beginning. So no history of injury, no problem. We can baseline test them, have that information. Immediately after injury, we can take that individual and test them again, and we can compare directly. This is where you were before, at your baseline. This is where you are post-injury. There is evidence of change, which is evidence of brain injury. We've got to get you off. We have to rehab you, but then we can follow the progress of that patient and eventually come to the point where we can say, let's retest. We retest. You're back to your baseline. You're good to go back and play. Okay. And there's things that we can do in the cognitive domain as well. But that is one of the big things we're really pushing right now is baselining. Okay, obviously for athletes, but we're just doing it for the general population as well, because it gives us better data to work with. And we also have more objective findings, so it's not as much guesswork on the back end. That's not to say when we see a patient that doesn't have a baseline, we're guessing. It's just that we can definitely have more objective information to be able to follow their trajectories and get them back to their normal state.
Talking about sports injuries today, Walton Raiders playing against Milton.
Yes.
Go Walton. Hopefully no injuries, please. Besides car wrecks, trekking accidents, slip and falls, what are other significant ways people suffer from concussion?
We see concussion sports, football, rugby, those kind of things. We tend to see it in soccer as well. And really any situation in which a person could hurt themselves, we can potentially see a concussion.
What tests do you offer at the Concussion Center in Atlanta, Georgia, to test for a TBI or traumatic brain injury and determine if a patient suffered a concussion? And based on those testing techniques, can you determine how long ago did the concussion occur? Days, weeks, months, event maybe years later or earlier, rather?
That's a great question. So when we're looking at a patient, we have a variety of different tests that we can perform, but we base it off of the symptoms. So again, we look at, on initial evaluation, we look at the 6 areas that are involved with a concussion to determine where are this person's problems. Okay? So for example, if you have issues in the cognitive domain and eye movement areas, well, then we're going to focus our efforts there. But if we don't have emotional change, if we don't have headaches, well, we don't need to waste our time, right? We don't need to waste the patient's time doing things that are just unnecessary. Now, again, that doesn't mean we're not going to look for them initially, but we use that initial evaluation to really figure out where are the problems so we can focus our energies. That's where we get our objective data. Now, we're really not able to say, based on this, that, and the other, that your concussion was 17 days ago. We can't really do that.
Sure.
What we can do, though, is we can use the patient's interview and medical history to just determine when, potentially when was an injury, right? If you fell 3 months ago, you hit your head, this is when symptoms started. We can look at, yes, we still have abnormalities, whatever it may be, and we can get a correlation between that. But we can't really say, hey, you came in, you think you hit your head 20 years ago. I can't pinpoint
not that far. Dr. Allen, what could be hidden dangers and long-term potential consequences of a concussion?
So with a concussion, after you've had one, your likelihood if you have two, your likelihood of having a third just rises and rises. And the issues that we start to see are, again, depression can be a huge thing. Emotional change, irritability, anger, mood changes. We also see that balance impairment can be a big one. Again, if you're dizzy, if your eyes are not moving appropriately with your body, it can throw up your ability to keep yourself balanced, which would lead to a potential for concussion. If we have cognitive changes, memory, concentration, those sorts of things, executive function, that could obviously be detrimental to work, school, whatever it may be. It can absolutely affect a person, which again could in turn lead to other issues like depression that are associated with changes in a person's ability to function. Sometimes we can also see some changes in people's ability to kind of regulate themselves. And what I mean by that is, is their blood pressure skyrocketing, right? Is their body temperature changing? Is their heart rate going up or down? What can potentially be happening from what we call dysautonomia, or basically your body's normal functioning systems are now acting inappropriately following that injury. And it can lead to a host of other issues as well.
Very interesting. Can TBIs, traumatic brain injuries, be missed in older adults? Why or why not? I know we touched on young people, but what about older population?
Absolutely. We do see concussion happen in older adults because of falls. One of the big things is that most people think a fall can be you fall over, you get up, maybe you broke a hip, whatever it is. And that's typically where we tend to focus our energies with older adults, because again, that's the visible ailment. The patient has a broken hip, they've got a broken femur, a broken tibia. However, what if they hit their head? Do we have changes in that person's cognitive ability? Are we seeing cognitive decline because of that potentially? So we absolutely can see that. Balance function, again, can absolutely be impaired, which could lead to another fall for that patient. It could lead to another head injury down the road. So we do see a lot of changes with older adults especially. And that's why falls are A, something we don't want to see happen, and B, they need to be evaluated from every aspect.
What age group is at the largest risk of a concussion? Why?
So it kind of depends. We see that usually falls are our older adult population. That's when we tend to see most TBIs occur for them is with falls. However, our younger adult population, we see that car accidents are typically the main cause. Motor vehicle accidents are usually the main cause. It's really something that we see throughout the lifespan. It's not necessarily just dedicated to 14 to 17-year-olds have the highest risk. We see it in all different aspects and areas for people's lives, and it's something we need to be aware of throughout.
And then cycling, football, baseball, and softball fall under the most frequently experienced concussions in this exact order based on brain and spinal cord.org statistical article published in 2023. How often do you get to see sport-related traumatic brain injuries, including concussions?
Every day. We see them come. So it's something that we're really trying to see if we can change the game a little bit with the baseline program. Unfortunately, what we see a lot of are athletes that have had a concussion and it's been a couple months and now they're not getting better, as opposed to if we had a baseline, we're able to evaluate that person right after injury or the day after injury and create a treatment plan and get them back to work, learn or play faster. We're seeing someone that's now suffering, right? It hasn't cleared up in a couple of days, a couple of weeks. It's 2, 3, 4 months down the road and we're still having these issues. So sport concussion is a very big thing. It's something that I'm glad to see there's a lot more awareness around now. I think that changed a lot when the NFL finally said, yes, concussions are actually legitimate. And there was a lot more information about concussion coming out. But it's one of those things that not every single person that plays football or cycles or whatever it may be, not every single one of those people is going to have a concussion, right? A majority of the hits that happen in football do not cause concussion. They're subconcussive hits, but they happen. And because they happen, we've got to be able to look for them and act quickly and appropriately for them.
And you have touched already a little bit on this, but can a concussion have an impact on mental health? How so?
It can. Again, like I mentioned earlier, irritability is a huge thing that we see because people aren't functioning like they were, right? If I was a high-level executive, high-power executive, something like that, and I got a 20% reduction in my brain function, I can't function appropriately. I'll give you a personal example. I was in a car wreck I guess it was about 5 years ago now, and I definitely had a concussion. I remember the day after, I just could not put things together. It was very hard for me to get ideas across, to be able to think through problems. I felt very foggy-headed. I had a lot of trouble just concentrating on simple things. Now, it cleared up for me quickly. I was fortunate from that perspective. But it's one of those things that I could absolutely see if that had persisted for a couple of days, couple of weeks, couple of months. Absolutely why people get upset, why they get angry. It's because you just can't do what you were able to do. The other thing, too, is insomnia, sleep issues. You're not sleeping well, that can lead to a whole host of other problems.
Absolutely.
And so we see that the mental health aspect of a concussion is a big area that we have to make sure we're looking at with these patients.
And your team at the Concussion Center is a team consisting of multidisciplinary medical professionals. Why do you need different medical specialists in evaluating a traumatic brain injury and specifically concussion?
So we like to joke a little bit around here. Concussion isn't necessarily difficult, but it is hard. The reason we say that is you do have to have a bunch of different specialists to be able to manage these patients. We have neurology, or Dr. Bashop, our neurologist, is here, obviously kind of the quarterback of care. Myself as an audiologist, I do focus specifically on dizziness issues, balance problems, eye movement abnormalities that happen with these patients. I also look at some auditory processing issues that can kind of relate with cognitive function impairment. We have a team of speech language pathologists that work here with us that focus on cognitive rehabilitation for these patients. We've got a great team. I actually, in the past, have done training with physical therapists around Georgia. And we've got a really good network of physical therapists that we work with throughout the Atlantis area and the state to help us manage a lot of these aspects. And we also have access to a couple of other specialists that we don't need for every patient, but when we do need them, we've got them and we can get patients directly to them to make sure that we can manage these areas. We need to make sure that we've got this full team, though, so that we can address any of these concerns that pop up. But we're not trying to figure out, hey, well, where does this person need to go? Who can we work with?
That's amazing. There is a lot of research centered around sports concussion. Why is that?
Sports concussion, most of the research has been done around that because the population is, in my opinion, they're better watch. Okay. If you have athletes that are playing football and every year you do a little bit of a screening with them, well, then you have a much higher chance of catching issues and being able to try out different techniques, different assessment strategies, and different therapies with these individuals. It is a higher, it's a much higher population that does have a concussion. Okay. So that's where a lot of the efforts have been put. And also, quite frankly, there's a lot of money in sports, right? So if you have an athlete that's making you, I don't know, $100 million a year, you're going to definitely want to spend a little bit of money on the back end to figure out, how do I evaluate this person? If something does happen, what do I do to get them better? So that's where we tend to see a lot of the information with concussion starting initially. We also do see a lot of it happen from the Department of Defense and the VA because veterans that are active duty military also have a much higher chance of a concussion, a lot of that through blast injuries. But the good news is that research, as it comes out, it filters down and can be applied to the general population really without any change. Just because it works for someone that's playing football doesn't mean it can't work for someone that's 75 and fell. So
absolutely. How soon someone suspecting a traumatic brain injury or a concussion should come to see a specialist at your or any other brain diagnostic clinic?
The sooner the better. When we look at a concussion, the sooner we can get started on treatment with a patient, we see that statistically their chances of healing and healing quickly skyrocket. So the sooner the better. We typically say rest for about 48 hours after injury. Of course, right after the injury happens, we need to look for some red flags that those are widely available online, but vomiting, loss of consciousness, any kind of seizure activity, those sort of things are a couple of the red flags that are out there. But as long as those haven't happened, we say, you want to rest for about 48 hours. And then we do want to start. We want to get managing that patient immediately. So.
And at your clinic, do you see patients who have some type of health insurance? What about if patient does not have any medical coverage?
It's a great question. So we see, a concussion can happen to any type of patient, right? Just because you've got Blue Cross doesn't mean that you're going to have a concussion in someone that doesn't. They're not going to have it. And so when we opened our doors, it wasn't to focus, to cater to just one specific patient population or one type of concussion is a concussion, and it can happen to anyone. So we want to be able to see any type of patient that is out there. We do take medical insurance of all kind. We do use, we do self-pay rates. We also do use a lot of medical funding. And I know that that's something that you work with, and it definitely helps patients tremendously being able to, get care, right? They don't have to necessarily worry about not being able to afford care and afford management. And I think that's something that's important because it allows patients to get better. Finances should not be a barrier to healthcare for any type of patient.
That's wonderful. Absolutely agree. Now, to conclude our conversation about concussion, why is it so hard to diagnose?
It's because we can't do one test. We can't just do, a MRI or CT and say there's your concussion. There it is right there. There are so many different issues that pop up with these patients and these type of injuries. We do have to be able to look at. So we have to be able to look at a bunch of different areas, and that's where the difficulty can come in with a concussion. I think the other part of it too, though, is that we still haven't done a great job with education, just generally as providers. We've got to get better about letting everyone in the healthcare system know this is what you need to look for. There's still a lot of misinformation, still a lot of myths out there, and we just need to continue pushing forward and making sure we can get that to both our healthcare providers as well as our patient population.
And in case somebody is expecting a traumatic brain injury or concussion, how can they locate your clinic? Do you have a website, social media sources, any platforms?
Absolutely, yeah. So our website is concussionctr.com, CONCUSSIONCTR.com. Our phone number is 404-946-9327. Those are usually the easiest ways. Our address, 2200 Century Parkway, Suite 260. It's Atlanta, Georgia, 30345. I'm not the social media guru, I will say that. So Concussion Center on Instagram or Facebook or somewhere like that, you'll find us. But that's not my area of expertise. I'll say that much.
It's out there. I know for a fact, and the address is very easy to find. I found this morning with no problems with GPS. And that was so great, Dr. Allen. Thank you again so much for finding time to talk with me about myths and facts about concussion, and for being my very special guest on the podcast. It's time for more injury funding today. But before we conclude today's episode, I have the last fun pop-up question. Are you ready?
I'm ready.
Okay. Who is your favorite podcaster right now? Or do you listen to podcasts at all? Oh, I love it. Thank you. I love it. And again, that was Dr. Robert Allen with the Concussion Center based in Atlanta, Georgia. Ladies and gentlemen, I want to thank you all today. For more tips and tricks about legal funding, personal injury related law, follow me. Like and subscribe at More Injury Funding, and it's time for More Injury Funding podcast. Also, you can find me on all the podcast platforms nationwide and worldwide, and also you can watch us on YouTube. Until then, thank you so much. Be well.